Insulin is a hormone produced by your pancreas. Now, you said that during your first pregnancy you had gestational diabetes and you were given insulin.
Yes.
Now, try to understand. Insulin is the responsible hormone for obesity. How do we say that? When you have excess of insulin and even after that your insulin is not able to work, that is called insulin resistance. So it is like you have something in excess but still it is not able to work. Now what happens is when you have insulin resistance, which is by virtue of your body fat, obesity causes insulin resistance. Now try to understand, if a woman who has a lot of insulin resistance and becomes pregnant, don't you feel that it will affect the fetus? It will affect. And how it will affect? Because there is a free flow between the blood mother and the blood of fetus. So the blood freely flows from mother to fetus to take nutrition and everything. Now what happens is when you have insulin resistance, the same message goes to the fetus that in this environment there is lot of insulin resistance. And you know one very important thing, in last 20 years the average birth weight of a baby has increased by 200 grams. You know the reason why? Because they are born overweight. Obese mother gives birth to a healthy baby, so-called chubby healthy baby. They are actually overweight. And then that overweight young born becomes an overweight kid because that message is there of insulin resistance, because the metabolism has changed from the beginning. That is what we call is all DNA, genetics. Overweight kid has a lot of insulin resistance. Obviously he will also develop fatty liver even at early stages of life. Fatty liver, insulin resistance, again a very bad and deadly combination. Once you have these two things, you become prone to become diabetic even at an early age. So try to understand that we are not just talking about today's time.
Yes, understood.
We are talking about what is going to happen to the next generation. And you will not believe, I have seen kid as young as 15-year-old becoming diabetic with no family history.